Hello, class. Today we're going to look at three situations: seizures, allergic reactions, and diabetics or diabetes. We will always use the check, call, care sequence for all these situations. At this time, we're going to start and we'll look at seizures, and we're going to go through
seizures, stroke, diabetic emergencies, breathing emergencies, and poisoning are all common types of sudden illnesses. To the untrained eye,
we are going to now look at a mission, and we'll walk through and go through this mission. If you look, a young lady has collapsed, and we'll start with the mission.
Deborah is having a seizure in the break room. You need to take action to make sure she is safe during and after the seizure. Your first priority should be checking the scene and removing any hazards you see.
Okay, so we look and check the scene. We'll
Notice
look over.
Anything here?
The chair looks like it's in the way, so let's click on it.
Excellent. Chair has been moved out of the way. When a person is suffering from a seizure, the best way to check the scene is to make sure there are no objects around that could injure the person during the seizure. If you're able to, remove any nearby furniture or other objects that may injure the person.
Check over here.
Everything looks okay over here. No apparent hazards. Good. You've checked the scene and identified all potential hazards. The scene is safe. While checking, you didn't notice any severe life-threatening bleeding.
Okay. So we don't see any severe bleeding. So let's click on. Now, a couple things are happening here. Obtaining consent. If she's unresponsive, obviously we would never put a stick between the person's teeth, and we don't want to restrain her at this point in time. Let's click what the arrow down here says. Talk to him.
If this is the person's first time having a seizure, or if you're unsure whether it is, 911 should be contacted.
Okay, so we're going to ask this gentleman, since he works with her, if she's ever had a seizure.
I've known her for years, and she's never said anything about seizures.
Okay, so we're going to tell Wiley to call 911 to get a first aid kit.
Okay, but is she going to be all right? I think you need to put a stick in her mouth so she doesn't bite her tongue. Oh my gosh, should we hold her down or something?
Wiley here is giving you bad advice. You should never attempt to put anything in a person's mouth when he or she is suffering a seizure. Also, never try to restrain a person having a seizure. This could lead to further injury.
Okay, I'll go call 911.
Deborah's seizure appears to subside.
Let's check for responsiveness and breathing.
What is the correct way to check for responsiveness?
Okay, so we have three choices. Shake the shoulder and shout, "Are you okay?" Tap the shoulder, shout, "Are you okay?" So let's just see which one, and let's just pick shout, "Are you okay?"
Oh. To check for responsiveness, first shout, "Are you okay?" Then tap the person's shoulder and shout again, checking for breathing. Deborah seems to have responded. Complete your check and observe her breathing.
Okay, tap the shoulder, shout again, and look for normal breathing. Are you okay?
Oh. Deborah seems responsive, and her breathing is normalizing. Now, place Deborah in a recovery position. Her body is in what is called the recovery position. This position protects her airway. After a seizure is over, it's important to make sure the person is breathing. In this case, Deborah seems to be breathing fine, although she's a little shaken up. After a person has a seizure, it's very possible he or she will be unresponsive or not alert at first. It's also possible for a person to feel drowsy, confused, or embarrassed if the seizure happened in a public place. That's why it's important to comfort and reassure the person, check for injuries, and stay on the scene until help arrives or until the person is fully conscious and aware of his or her surroundings. As you continue to monitor Deborah, EMS arrive to take over.
Okay, we'll return home, and we're going to pause for a second.
Anaphylaxis is a life-threatening reaction where the airway can swell, making it difficult to breathe. If not treated, it could ultimately lead to death.
We're in a situation in a restaurant where the person...
I thought you checked. Oh no. Did you eat any yet?
Yeah, I did. Oh, man.
Are you okay, Art?
I don't know. Oh, my throat is swelling. Art is showing signs and symptoms of anaphylaxis, which can be a combination of difficulty breathing, wheezing or shortness of breath, a tight feeling in the chest and throat, swelling of the lips, face, throat, or tongue, or weakness, dizziness, or confusion.
It's going to be okay. Do you have your epinephrine auto-injector?
Since Art had an epinephrine auto-injector, he used that to counteract the effects of the anaphylaxis. If the person has one on hand, use it as soon as possible, instead of delaying care to call 911. Before helping a person suffering from anaphylaxis, be sure to confirm a history of severe allergies, look for signs and symptoms of anaphylaxis, find out if the person needs help administering the auto-injector, and check that you have the person's own prescribed auto-injector. It is also important to be familiar with your state laws related to helping with an epinephrine auto-injector.
How do you feel?
A little better, thanks.
I'm calling 911.
When a person is suffering from anaphylactic shock, call 911 if the person has trouble breathing, complains of the throat tightening, explains that he or she is subject to severe allergic reactions, or becomes unresponsive. While waiting for EMS to arrive, Candace will monitor Art's breathing and for any changes in his condition. If the symptoms persist for 5 to 10 minutes without EMS on the scene, a second dose of epinephrine is advised.
Okay, we will pause here.
A hormone that regulates glucose levels in the blood. There are two types of diabetic emergencies: hypoglycemia and hyperglycemia.
Make sure you remember those two.
Simply put, hypoglycemia is the case of too little sugar in the blood, and hyperglycemia is the opposite, too much sugar in the blood. Both have similar signs and symptoms: changes in mood and levels of responsiveness, rapid breath, feeling and looking ill and dizziness, headaches, or confusion. Hyperglycemia generally comes on more slowly than hypoglycemia, which can come on quickly and unexpectedly. If you think someone is having a diabetic emergency, whether it's hypo or hyperglycemia, it's best to give the person 15 to 20 grams of sugar in the form of their own glucose tablets, or if not available, candy that can be chewed, orange juice, fruit leather strips, or milk are good alternatives. Only do this if the person is awake, able to follow simple commands, and safely swallow.
Okay, looking at this brief summary again, a diabetic emergency is caused by an imbalance between sugar and insulin in the body. So there are two types, as you can see: hypoglycemia and hyperglycemia. Okay? Hypo would be too little of the sugar, and hyper would be too much. If you see the suspect, or you suspect a person is suffering from a diabetic emergency, of course, if you know the person's situation, you feel much more comfortable. If the person is alert, you can talk to them. Remember, we always use check, call, care. Okay? Check the situation if it's safe. Okay? Check with the person if they're responsive. If they're not, okay, you call 911 if they are, and you can still call 911, but you can ask them questions, obtain information, and you would then utilize the care sequence. And you can see in this case how that summary would be beneficial. Okay, we will have, let's see, I'm going to have approximately 6 questions following this, but there is a bonus question. And if you watch the video, obviously you'll get the bonus question. The bonus question is, what department does my wife work in at Thaddeus Stevens? Just to make sure you're listening to this. And her name is Mrs. Grove, Mrs. Laurie Grove, and she is the director in career services. So if you do see her, say hello. That's just a bonus point of 1 point. Okay? Any other questions, please always email me, and or hang in there and do your best. Take care.